Men, are you taking Mounjaro? I would like to know which men are taking Mounjaro because, again, it is not something that a lot of men talk about. You don't hear any man saying, I'm on Mounjaro. I mean, women are more open to saying they take Mounjaro injections for weight loss. But very rarely do you hear a man say, I've taken Mounjaro for weight loss, unless they have other underlying conditions such as maybe diabetes or sleep apnea. And there is no harm or shame in men taking Mounjaro if the indication is that you need to lose weight. And especially for men, if you've got a BMI of 30 or over, you could be having a BMI of 40 or 45, 48. So that's having a BMI of 30 or over. Or if you've got a BMI between 27 to 30 and you have underlying conditions such as type 2 diabetes, high blood pressure, high cholesterol, sleep apnea, heart diseases, then in the UK especially, you fulfill the criteria for having Mounjaro. And this is to make sure that Mounjaro is not given to the wrong group of people. These are the right group of people that should take Mounjaro. So if you're a man and you fall under these ranges, then go and speak to your doctor and they'll look at your options as to what is best for you because there are other weight loss medications out there. There is ozempic, there's wegovy, there are tablets such as orlistat, and also there is what people forget now: exercise and dietary modifications that you can make to your lifestyle. So it's not just taking injections, it's what other modifications can I make to my lifestyle on top of taking these injections. So if you're on one of these weight loss injections such as Mounjaro, if you're not exercising and changing your diet, you're not going to see the best results as opposed to just taking the injection on its own. As a man, if you're taking Mounjaro, expect to lose 5% of your body weight within 6 months. And studies have also shown that you can lose anything between 10 to 20% of your body weight within 72 weeks, which is about 8 months. So that is quite remarkable. But do be aware of side effects such as nausea, vomiting, diarrhea, skin reactions around the injection site, hair loss. Especially if you're losing hair already, the last thing you want to do is lose even more hair. So if you notice any hair loss of Mounjaro, speak to your doctor straight away. Also, pancreatitis and gallstones. A lot of people don't mention that, but if you're having severe abdominal pain, if you're having fever, if you're having nausea and vomiting, suspect that could be having pancreatitis or gallstones and speak to your doctor. So as a man, where would you inject it in Mounjaro? You can inject it in your upper arm, in your abdomen, or in your thigh. And in terms of the dosing, you start with a low dose, which is 2.5 milligram dose, which you take for 4 weeks. After 4 weeks of stability on the dose, you can then increase to 5 milligrams, which you take for another 4 weeks. And then what can happen is that every 4 weeks, you're increasing the dose by 2.5 milligrams until you get to that stability dose where basically you're happy that you're losing weight on this dose. So every 2.5 milligrams would be 7.5 milligrams, 10 milligrams, 12.5, then 15 milligrams. So between 10 to 15 milligrams is usually classed as the maintenance dose, which means that most men would be on anything from 10 to 15 milligram dose of Mounjaro as a maintenance dose. Most men, would expect 12.5 milligrams or 15 milligrams, but do be aware that it could be that the higher the dose, the more the side effects you are likely to experience. So maybe you might need to drop down a bit so that you experience less side effects with the Mounjaro drug. Again, be aware that if there is a family history of medullary thyroid cancer, or you yourself have had thyroid cancer, you might not be eligible to take Mounjaro. If you've got kidney disease or acute kidney injury, if you've got background of pancreatitis or even gallstones, then you should avoid taking Mounjaro and consider other options. So men, tell me, what has your experience been of taking Mounjaro? Please drop some comments below.